Hi, I'm Dr. Lisa Simpson, President and CEO of Academy Health. Welcome to our Future of HSR interview series. As Academy Health celebrates 40 years advancing health services research and health policy, I wanted to build on that history to look forward at how our field is changing and how we might align our work towards higher impact, more equitable research in the future. In this series, I'll be talking with leaders in health services research, in health policy, and innovation to reflect on where we've been and, more importantly, where we're going next. I'm Dr. Lisa Simpson, and this is the Academy Health Future of Health Services Research series. Today, I am really pleased to be talking to Dr. Robert Blendon, the co-founder and former president of the Association for Health Services Research, which you may not know, merged with the Alpha Center 22 years ago to become Academy Health. So today, thank you for joining me, Bob. I'm excited to go back a little bit in time because to really understand our future, we also have to understand where we came from. And so I'm really interested to hear from you about how this came about and what are some of the directions that you think we have to keep in mind for the future. So let's start with the past.
First, just for listeners, our first meeting, I think we had 12 people. So the association has become a spectacular success, range, number, how important it is. But early on, it was not clear how far this is going to go. So this is so exciting for me to be here all these years later and actually look at something viable, important, and shaping of what's happening in healthcare in the United States and actually in other countries.
Thank you, Bob. That's great. So given that growth and that change over the last 40 years, when you started with your co-founders, what was in your mind when you formed the association, when you got those 12 people in the room?
First, you have to understand that by somewhat of an accident, I was a doctoral fellow with a research and policy project by the President's Science Advisory Board, which looked at the future of health services research. And they borrowed a few doctoral students to work with them on that, and which was important with a very prestigious, heavily weighted the biomedical sciences board. I spent my time thinking about with them the future of a field that didn't exist. And so from the minute I left that effort, I was very much oriented to the need to build this field that was going to make these incredible contributions because the committee was so excited. And it's very important to understand what the committee talked about as others later. The committee was overwhelmed with a history of biomedical research. And for those who think it's just centuries old, in a few decades, we went from medicine deciding based on individual experience, small studies, traditions, to absolutely across the country. Physicians made decisions based on clinical trials, case control, epidemiologic studies, basic science, and across the country, if you weren't using those results, you were criticized substantially for that. So the committee, again, weighted with that history, said, why can't we use the same techniques to have a system works that saves people's lives and is affordable? Why can't we just take this kind of rigorous research, put it into place? And I was at a stage I couldn't believe, of course we could. But that's how somebody very young gets in this discussion. Well, you can't have a field unless you have an association. You need colleagues talking about how to build this, and you need a series of strategies. And across the country, there were a small number of academics who shared the same amount, that they absolutely had faith that we could make the healthcare system in this country work if we applied rigorous research and analytical. skills to it. It could be done. We don't have to make decisions based on just personal intuition or experience. And that's the original groups that got together.
That's really interesting, Bob. And I'd love to hear a little bit more about, you talked about what you guys thought about, coming together to form an association to replicate this biomedical model. Who else was in the room? Who else was involved in really this creation of our field and through our association?
So the committee, President Science Advisor, was very heavily weighted towards prominent biomedical scientists and very prominent social scientists, Victor Fuchs, David Mechanic, who really had a real faith that research could actually transform. And the initial groups that worked on the association are people that did have some Washington contact and experience. What brought them together is a recognition that Washington will make decisions that could determine the future of healthcare in this country, and that research could play a role in that. And they brought with it this faith in research to do that. But there was a practicality in terms of Washington understanding among the original founders, which is very important. And it led to another issue that we'll discuss is they made some decisions about setting the association up that are very important today.
Great point. And I love that blend of both the faith in the research and the value of research to change, and the practicality and pragmatism of who's actually making the decisions, who can implement the change. And that's a part of our Academy Health and our fields. We're very applied. Given that that's the origin story for Academy Health, what did you not expect that did happen? And how would you assess where we are today?
So the issue that we missed, and so did many of the funding agencies for our field, we were so struck by the success of biomedical research being implemented. We didn't think it would be a great critical problem. Would anybody that made decisions use this research? Because in medicine, they were using trials. What did the Lancet say? New England Journal said, NIH has put out these guidelines. People were using them every day. So we would put out in healthcare costs, et cetera. And what we missed was that in this field of dealing with policy and systems, there are huge political dimensions, cultural dimensions, and extraordinary institutional resistance to changing. We didn't study those things. Why study it? Because that didn't hold up implementing cancer treatments. Nobody said Republicans don't like this or Democrats like this, and for that, and our cancer unit doesn't like this for some reason. They were implemented across the country. So we have a field which is caught in the fact that America has become unbelievably politicized. It has nothing to do with our field, our research, our concerns, but we don't discuss it very much, and we don't do a lot of research. And there's not a lot of how this was passed in this state or that, how this was added or not, why institutions who are shown research that they're as uncost effective as you can be keep on doing what they're doing. Many of the mergers and consolidations are hardly cost saving and not clear that they improve services. And when somebody has a study that says there's no evidence here, they just keep on doing it. So we didn't pay attention to what's called in some of the social science implementation research for that. And the funders were so convinced if we only had stronger studies, of course we do this. And so 40 years later, what strikes you is that the White House is still talking about covering more of the uninsured in the future. And we haven't found the way in 40 years to be more effective. And because I believe heavily in research, I think more research trying to understand how to influence decisions would be useful in the next 40 years.
I mean, you raised such an important point about the context we're living in today and how different it is. On top of, I think, a longstanding challenge with implementation, and given the focus of health services research on policy and systems, the reality that we are a country of 50 very different states and
Yes.
territories, and understanding context and politics
Yes.
and history
Yeah.
is critical to implementation, and we need to do more of that. So you've raised two things: implementation and partisan context. As I want to ask you, given where we are today, as you've described it, what advice do you have for the next generation of health services researchers and for us here at Academy Health on how do we get better at those challenges that we're now facing?
So, because I have a faith in research, I think there should be an emphasis of trying to grow federal and foundation research that focuses on institutional behavior, political behavior, looks at states differently. I mean, you have to realize that California has a larger population than Canada. So California and Texas, which is close, are not going to be identical in today's world. And we don't encourage researchers to look at the differences across states. And that is critical, but there's a funding as well as a professional issue. The funders have a biomedical view. If we only know the right treatment for cancer, everybody will use it. Not that in Texas, they won't open the results. We have to understand and we have to support people. And also, the association is involved with a number of training programs. We want to emphasize some training for research on systems, on states, on the Congress. Not that, oh, I left the field and I'm studying congressional voting behavior. No, that's part of what we want to train a generation of health services researchers. So there's an understanding that the analogy which I fell in love with, the biomedical research, is not identical 40 years later. Yeah. And to move ahead here, you need other pieces, including understanding management, but the behavior of management at institutions. And we really have to encourage that work in funding and encourage it in presentation.
No, thank you. That is really important, and you've laid out some good directions that Academy Health is already starting to move into in terms of the skill set that we need to be more effective in the future.